So one of the projects I was involved with was patient advocacy. I was working with a group that are people living with and affected by HIV/AIDS. And a lot of the people living with the disease were indigenous peoples. Doctors were from other countries. The communication was not always optimal. And so I would be in the middle helping people understand each other.
So that's where the language part is really important.
Guyana is the only English-speaking country in South America. It's more of the cultural and being able to speak to both doctors and the people and understand
that's where you
the culture.
teach me, because there's so much that we don't know. There's so much like people like me and other Americans tend not to know a whole lot about other countries. And we're not told a lot. And BBC News will definitely, that's a different subject, but when I watched BBC, I realized that I knew nothing from my own news. So there it is. So I would say that if you really worked hard, and one of your biggest accomplishments would have been stopping the transference from mother to child. Wasn't that a huge accomplishment?
That was, within the country.
Yes,
itself.
within the country.
Within the country was huge.
That is a huge accomplishment.
Yes.
That would require a lot of participation from the mother.
A lot of participation from the health system and from the mother. The nurses, mostly nurses. The health system is nothing like what we have here.
Right.
So it's basically nurses who do all of the education around HIV/AIDS with the pregnant women and counseling. And one thing I think we tend to forget about is the stigma and discrimination is huge. I lived in the capital city, but the capital city only had 33,000 people. Everyone knows everyone else in their business. So if someone knows that you're HIV positive, it is a very bad situation. So healthcare workers, community workers work very hard to treat people the same. So there is not an awareness by other people.
Right, and with all that in mind that you just told me, I realized what a great accomplishment that was to keep the transference from mother to child, and the countless lives that you saved completely and totally. Is just, it's off the charts what you've done. Anybody else?
Well, like Erin, I was an English teacher and trainer, so I wasn't a specific health education, that wasn't my project, but all of our directors encourage us to work or to do projects in HIV/AIDS, or so I ended up falling into secondary projects that involved community health education, and so I had a youth group with women. We did life skills, and one of the things we talked about was HIV/AIDS prevention, education, awareness, and we did street fairs together, and then in the rural community, we also I worked with other youth, and we did workshops for the high school students as well, with the same life skills and awareness, education.
Saving a lot of lives talking to the high school students, I'll tell you.
It's more, I'd say it's less about saving lives, but more about just prevention and
prevention.
Yeah,
right.
And so even if it's just one person that you can kind of help them to make better decisions about what
that kind of thing. Absolutely.
Yeah, and just even the awareness, and especially in rural towns.
And the discrimination part to.
Yeah, exactly. Yeah.
Anybody else?
And that's what I focused on as well. As Pam mentioned, stigma and discrimination is a big part of HIV and AIDS, and so I worked at primary schools teaching computers. And so with my 6th grade students, what I did was incorporate a very simple activity where we just addressed some of the stigma and discrimination issues that are popular or that are prevalent in the Caribbean with regards to HIV and AIDS, and worked them through on the computer, and also sat down and talked them through. And so that was a way of addressing some of their misconceptions that they might have had growing up, starting at an early age.
Right. That's really important. That's just so rudimentary. Do you have anything?
Yeah. So I was an HIV/AIDS volunteer. I served as a PEPFAR volunteer. And so my main project was supposed to just be dealing with HIV/AIDS. And so I did similar to what Perry did, life skills and prevention talks, but I really focused on the testing of it. And so I lived in a very rural area, and there was no testing in my area, so they would have had to walk 30 miles to town to get tested. So towards the end of my service, found a mobile testing unit that drove out to my area, and we did a 4-day testing event with HIV positive speakers, dance, drama, and going through the kind of the local hierarchy. It was in chiefdoms, and having the chief and his wife be the first ones to test, and then below him were the headmen, and having the headmen test, and then the villagers having an opportunity to test. And so by the end of the 4 days, we were able to test about 800 people, which then a pilot antiretroviral treatment started to be piloted in my area where they were doing mobile ARVs. And so now the mobile testing unit goes out quarterly there to continue the testing process, and then the ARVs are doing the mobile work out there.
Sounds like really hard work, in all honesty. That sounds like very difficult work that it takes a very brave person to do. And we do have a video coming up in a moment, and when we get back, I think we're going to very briefly talk about hosting country nationals, volunteers, and that, and then we're going to go back and talk about some more things. So anytime that a video clip is ready, and it involves
Peace Corps is evolving in the 21st century, and part of that process is evaluating where we can make an impact so that the relevance of the Peace Corps remains strong. Sadly, the pandemic of AIDS has issued a mandate, and that mandate is that we must be responsive and assume some responsibility for reaching out to men, women, and children throughout the world.
I am Kacharis Martin. In my former life, I was a director at a hospital in West Palm Beach area in Florida, and decided that it was time to give something back. PEPFAR is the President's Emergency Plan for AIDS Relief. One of the focuses is on OVC, orphan and vulnerable children. You're dealing with people that have been affected by the HIV/AIDS pandemic. One of the things that it really seeks to do is prevention. Prevention is a big part of the PEPFAR program. You have to exercise. PEPFAR participation in my NGO, it has allowed myself as a Peace Corps volunteer to utilize skills and utilize information to put together different things for the NGO. You want to do capacity building in such a way that even when you leave and you go home, those programs that you've helped to start are still intact, that you're not starting something that after you go, it's going to fall flat on its face.
I think you can read and read and read about how things are going on in Africa concerning HIV/AIDS, but until you see it firsthand, it's nothing like it. Seeing a mother, lose their child, and because they weren't able to find services, it really makes an impact on you, and you have that face of that person every time you deal with the next patient. Before I came to Nkangye, the situation concerning HIV/AIDS was fairly not talked about at all. It was pretty much denied by the residents here. The percentage is a little under 50% are positive, HIV positive, and now, since I've been here for a few months, people are more comfortable approaching people at the clinic, talking about HIV/AIDS, more comfortable coming to the test. I think any day where I can talk to someone who approaches me to say, hey, Mbako, that's my Kalango name here, and they'll say, oh, I tested, and whether they're positive or not, they're hopeful of whatever status they are. And they know what resources they can go to find to help. It's a good feeling because you know that education that you're providing is reaching out to people and they're actually willing to come to talk to you about it and be proud of it.
There was a need for someone to visit patients because many of them are abandoned and they don't have anyone to visit them. I felt like it was something I really would like to do. You had a smile on your face, sonrisa. My role is basically a listener and expressing to them their strengths.
Happy face.
Happy face, sí. Yeah, they're in this bed and they're pretty sick, and a lot of them in their last stages. If they smile, that makes my day. Giving them a sense of hope. I think that's one word that expresses a lot with patients. They can have that hope to continue to the next day.
It is long, it is difficult, and it is very challenging work. It brings an emotional price, but they are there to provide a helping hand and to help the next generation. And perhaps that's one of the most important dimensions of what we do, is that by training young people, we perhaps save the next generation from the reach of this horrible pandemic.
Entonces, nosotros vamos a pintar. Ahora vamos a pintar. You have to target the kids while they're young, to expose them to it, to talk about it, to say this is real, this exists. PEPFAR is highly involved in my Peace Corps service because PEPFAR is one of the sponsors of Escojo, which is an initiative for training youth to go in their community and to disperse information about HIV and AIDS prevention and making healthy choices. Dealing with HIV and AIDS, it is a very personal issue. They need somebody that's gonna build in what we like to say here in the Dominican Republic is confianza, which is trust.
I think it's very important to do large-scale activities in rural communities where they don't have access to media, they don't see a lot of what's going on, they're less conscious of what is around.
When it came to World AIDS Day, we said, well, we need to do something. We need to do something big to empower our youth to feel that they could work together, that they weren't alone, that they could work with other communities and find other youth that were also working on the same issues.
Abstinencia! Fidelidad! Abstinencia!
The idea was to plan a World AIDS Day march.
Our group of peer educators designed poster boards with different slogans that we use in AIDS prevention. And so we marched through the town saying, I secure my life, I protect myself from AIDS, and I maintain my promise to not turn my back on AIDS, not discriminate.
What is the science name for a germ? I am working as a teacher here, teaching HIV and AIDS, doing behavior change communication with the deaf. This is a hard one. The work that I'm doing here it's important on a personal level with these children. They are often seen as an outcast of society. In homes, they're put, in the back room, they're hidden, people don't want to know about them. They don't get the exposure that hearing people do. I think PEPFAR is very important because here in Kenya, it's sponsoring Peace Corps volunteers to be here working. And to send somebody that's here for 2 years to really get to know the community, to be an ambassador to the United States, and to explain the reason why we're here and where the fund is coming from. It speaks so much more to the community that how PEPFAR in the United States, their active role in fighting HIV and AIDS.
I've been involved with the HIV/AIDS community in the United States for about 20 years. So when I arrived in Ukraine, I found out people don't know about it, and it's growing because it's not being talked about. And I said to myself, I have to make sure I'm still involved with this. 25% of those diagnosed with HIV are younger than 20 years old. I've heard people who are 20 years old saying, "Oh, I heard you can get HIV/AIDS from mosquitoes." They need the basics. Have not yet turned 30.
I think that the Peace Corps in Ukraine is a very good ally in the PEPFAR program because Peace Corps has a very large number of volunteers working in the smaller towns and the villages. They cover areas that are not normally covered by other organizations.
What have you guys heard about HIV and AIDS? This group has actually helped me a lot in regards to knowing what problems and issues there might be in the community, and their thoughts are going to help me to create a program to give them empowerment through education is what I think is important. I also want to make it a comfortable environment, not so much that we're telling them what to do and what not to do, but more just to present them with information.
Volunteers who are placed in schools have contact with the children, the students, other teachers, and so there's a great opportunity for them to raise HIV awareness and knowledge of the disease.
We work in Ladysmith, South Africa on a project with people living with HIV and AIDS, orphans and vulnerable children, home-based caregivers with people. We are teaching as much information as we can give people about the virus.
Treatment and medical facilities. For generations in the Zulu community, when a child was orphaned, the extended family would step up and take care of the child. AIDS has been so devastating in these communities that the extended family doesn't exist in the same way anymore. We've come across households where the head of household is 10 years old, taking care of younger brothers and sisters.
We happened to meet a drama group of young local men, and they were very interested in doing a workshop with the children.
Mabumba is the name of the theater group, and they're trained in what's referred to as life skills, issues around HIV and AIDS, issues around self-respect, keeping yourself safe, issues around living positively. In the midst of so much hardship, in the midst of so much trauma, to have people so joyful is really very uplifting, very inspirational and edifying, and very fun.
The Peace Corps volunteers have taught me a lot about AIDS, and they make you think more about people. They make you want to help more people.
It's quite important that Peace Corps volunteers brought not only their professional expertise, but also brought attitudes, human dimension to HIV/AIDS problem.
We feel Peace Corps should long live and should continue supporting us with those volunteers. It also brings in a sense of solidarity that we all have to care for each other.
That was really informative. I've always known that the Peace Corps did a lot of good things, helping people live better lives. The simple things I always pictured them with was like irrigation, or helping develop their communities with plastics or irrigation or business, and all the things that we think about. But to really tackle a difficult issue like HIV/AIDS is really, I had no idea that they had taken such a really big stance on this issue that is really difficult to work with, and a lot of people walk away from, or at least stand back and take pause, because it'll make you do that. It's just human nature, and we can override that and rise above that, and that's what you're all doing. And Lauren, tell me a little bit more about what I just saw, and Fill me in a little bit on that.
Right, so the video was really relevant towards my service. The project I was under was the PEPFAR project. So PEPFAR came in as an emergency fund for AIDS relief that George W. Bush put into action. And it provided Peace Corps countries to be able to implement projects directly around HIV/AIDS. And so the projects we were working on were supposed to be directed toward with relief towards orphan and vulnerable children, people living with HIV/AIDS, and then around prevention, because we're talking about communities that really have no, there is no health care. So the only way you can combat the disease is through prevention. When drugs aren't available, you need to be able to prevent the disease. And so the projects that people are implementing are really grassroots based, and so it's working with around food security for people living with HIV/AIDS and around orphans and vulnerable children. It's around the education with the youth and the adults. In Zambia, the prevalence rate when I arrived was 18% of the country. There's about 1,200,000 people living with HIV/AIDS, 800,000 orphans. And it's one of the highest HIV rates in the world. In the urban areas, it's 25% of the people. In the rural areas, it's about 10%. So it's a huge issue, and the morbidity and mortality around the pandemic in Zambia is very real.
It's amazing how much just talking with you and watching this just right now at this moment has totally educated me in a small way, but a big way. First of all, you talked about healthcare. I always think about healthcare on a first world level. Our healthcare versus, like I saw on TV recently, Japan's and Switzerland's and Germany. And oh, well, we're falling behind. But then, whoa, you're talking about something way off the charts from my mind. No healthcare at all. Mm-hmm. And if they come down with this, no medicine. That is just mind-boggling. I've been highly educated about that. Now we're going to go on to World's AIDS Day in just one moment, but with all that, is there any last thing anybody wants to say on where we're headed, what we just talked about? Does anybody have or are we going to go on to World's AIDS Day? Well, it just blew me away. I'm telling you, I've learned so much. What an eye-opener, and it's all because of the Peace Corps. So let's talk a little bit about World's AIDS Day and what you did.
Yeah. World AIDS Day is December 1st. It's international, and it's really important for Peace Corps and for Peace Corps volunteers. This is the day where, the culmination of all our projects usually come together, and we do something for the community. In my community, we did a march through the town with all my students, boys and girls, and just kind of, shouting out slogans and just really bringing the community together for that. It really also depends where volunteers serve, and I know everyone here on this panel has done something special for AIDS Day. So maybe we can go down.
So if I wanted to do something for World AIDS Day along the lines of the Peace Corps, and I'm just me, is there anything for me? Or do I have to get a little closer to you guys?
I'm sure there's numerous things going on here in Tucson, in the community of Tucson. You might want to check with the Southern Arizona AIDS Foundation. I'm sure they've got something going on December 1st. I myself am having a discussion panel on the U of A campus from 10 to 11 in Career Services Student Union. That's the little things that we're doing here in our communities too, but I actually really would like to hear some of the stories of the volunteers and what they did on World AIDS Day.
Okay, let's listen to them.
Well, in the capital city, things were a little different, not really such a community. So what I did is there was a work day for at-risk young girls, and these were very young, probably 3rd through 6th grade, and did a puppet making workshop where it was very humbling because things we take for granted, like construction paper and tracing, was not something that they knew how to do. So I had to step back a bit, but we were all making puppets so that they could then use them to write a play with the puppets about what they knew about HIV and AIDS and then to present it. And so there would be a forum for discussion within a very young age group. So.
Okay, and with my experience, my first year I was a participant in a World AIDS Day street fair, and so my second and third years I decided to actually get some started. I lived in an urban community, but I worked in a rural community, so I worked with my youth group that I previously mentioned, and we had a small street fair. We handed out pamphlets, we collected health materials about not just HIV and AIDS, but STIs, sexually transmitted infections, and other health-related materials. So we tried to get the community to come to the main fair. And my second year, it was a little bit bigger. We had music, and it was just even bigger and better. So.
I lived on a small island, and what we did was similar to what Aaron had mentioned. We had coordinated a march with the school children just to walk around the main central town, and mainly just to raise awareness, especially just among younger children. At that age is really where we started.
December 1st is World AIDS Day. And where will you be? Well, let's be doing something to serve the community along those lines on World AIDS Day. And Aaron, what are you going to be doing on December 1st?
That's right. Yeah, I'll be having my panel on HIV/AIDS awareness on the U of A campus from 10 to 11 in career services, which is right above the student union. Yeah.
And what can I do? I mean, can I go? See you?
Yeah,
talk to you?
Yeah, it's open to the public, and we'll be having a panel. We'll be talking, showing videos, basically the same thing we're doing here, except hopefully I want to have community participation with that.
So you're going to be discussing this, and draw me a picture. You're discussing it, and there are going to be chairs. Can I hang around and listen to you guys discuss?
Yeah, exactly. It'll just be like this with a studio audience, and we'll be talking.
And you're going to have? Are you going to film it? Or are you going to preserve this so that you can use it later?
That's a great idea. I could do that.
You should.
I haven't thought about it.
Absolutely.
But I could, yeah.
Get out those cameras. Right. I'll bring a camera.
All right. There you go.
There you go. I'll bring a camera. I sure will. I'll bring a camera, and if I can do that, let's do that. We'll make a deal on that one. Well, we got a couple more minutes for the show, and we just want to remind everybody to be a part of World's AIDS Day. On December 1st. And Aaron, tell them where to be one more time, just so they know. Get out that listen to Aaron now. He's going to tell you where to be on December 1st.
It's on the University of Arizona campus in career services, which is the fourth floor of the student union. It's from 10 to 11 a.m. And if you can't make that, there's numerous other things going on in the community here. First week in March is the Peace Corps Week, which is a great event for Peace Corps volunteers we got in the community. We'll be doing class talks, anything like that. But what you really want to come to is on March 2nd from, I believe, 4 to 7 is the Peace Corps Fair, which is, it's going to be in the student union, and that's a great opportunity for people to come. There's going to be over 50 volunteers, returned volunteers, representing a bunch of different countries. Great time to talk to volunteers, hear their stories, kind of get a sense of what it means to serve as a volunteer, as a Peace Corps volunteer.
That is really what you all ought to do. World AIDS Day, December 1st. Be there. For any of the other dates that you just heard for the Peace Corps, if you're interested, please be there. They need you. There is a world to serve, and you will get your service back many times over. So thank you all. Thank you all. We are so glad. Hey. I am so glad that I got to know you. This is not the last time, I hope, that the Peace Corps will be on my show. I wish to have you back again talking about all of the issues. Thank you, everybody. Goodbye and good night.
3, 2, 1.